it back, introduce wheat back, and then see if you get your symptoms. And the symptoms, if you do have an issue with it, your symptoms will come back may come back immediately, or it may take a day or two for your symptoms to come back.
And is it possible with the wheat, but also with other sensitivities, to be able to handle the food in small amounts?
Yes.
And not large amounts?
Yes.
So if you just have a little bit,
You're okay.
If
Unless
you
you're
have
celiac.
Unless you're celiac, yeah, we're talking gluten.
Poison.
Yes, yeah. So if you're diagnosed celiac, none, right? But if you're gluten sensitive, again, there's a spectrum of how much you can tolerate.
How long does it take, once you notice that you have these things, how long does it take the gut to heal, and what can you give the gut to help it heal?
So the probiotics would be the first thing. I will tend to work with herbs rather than supplements. Like there is L-glutamine, but in the kid with Down syndrome, you don't want to be giving just single amino acids to them. You want to be giving them in a complex form. So with the kid with Down syndrome, I wouldn't do single amino acid like glutamine, but I would do herbs like there's marshmallow root, there's slippery elm root. That will help with healing the gut. Depends on how bad the damage is. So if it's, you've been off of gluten for quite a while and you had one oops moment, if you're not celiac, then it may take maybe a week or so for you to regenerate back. But the lining of the digestive system regenerates every 4 days. So it depends on how much damage you've done. Any other questions? And then the thyroid antibodies too.
What was the one in the middle?
Which one? The endomysial antibody? That's all celiac. That's all celiac. Thyroid antibodies, you want to also get tested too. If you're going to do any kind of antibody, throw them in at the same time. So if you're doing the celiac, ask your doctor to do the thyroid too at the same time. Okay, so bear with me, this is technical. So we're going to get into the
Down syndrome, genetics is like all of us. All of us have this built inside of us. So let's pretend we're making cookies. So for actual cookies, you need, say, a cup of flour, half a cup of sugar. With kids with Down syndrome, what they have is they have a slightly different recipe. So instead of, say, that half a cup of sugar, they'll have 3/4 cup of sugar. So a little bit extra. And then not extra, but extra chemical, but that extra quarter cup of sugar is what makes it different. What makes it special.
I'm really proud of her. So that's from the same video too. And as you can see, I'm technically challenged. Okay, so any questions so far about the complaints that we can typically tend to see? Yep.
Do you have any ideas for breakfasts that don't include a lot or any carbs that are healthy and simple to make on a busy morning?
Hard-boiled eggs?
Pardon me?
Hard-boiled eggs.
Hard-boiled eggs. With what?
Some people just do it straight up. Scrambled eggs, maybe?
Yeah, but what if you eat an awful lot of eggs?
Okay.
You want eggs.
So what I'm doing with my older son is I will give him a protein shake along with regular food in the morning for him. Typically, like you can do, that doesn't take long to make, right? You said. You could make healthy, nutritious waffles or muffins on the weekend, and then you just have to bake them up, right, or warm them up for breakfast. So throw in lots of, the nuts, the seeds into it, lots of fruit into it. So it's going to be pretty nutrient dense. You're not convinced with that? You do need to do some prep.
No, I'm just thinking less carbs though.
You don't have to use the flour though. You can use almond flour. Right, so almond flour is just going to be almonds made I'll cramp it up. Okay, so it's not going to be, it won't be, you can actually make muffins that are pretty protein dense with almond flour or nut. You can put in nut butters too. Okay.
I think we get tied up in the notion of, typical Western diet breakfast, what that's like, and in trying to recreate it differently. Sometimes it just doesn't work. But that whole, nut butters, bean butters, dip and bean butter, I mean, it's not in your brain sort of what you would have for breakfast, but kids think it's fun.
Yeah.
My daughter's favorite breakfast is a bowl of homemade soup.
Oh, okay. I had a colleague when I was in school, and his breakfast was herring.
Yeah.
Was what?
Herring. He used to sit right beside me and start eating herring.
First thing in the morning.
First thing in the morning, yeah. I loved him. That's why I still sat beside him. But you're right. It doesn't have to be the conventional, right? Just you can do the soup. You can anything really goes. Or you just have to warm it up.
She likes homemade bowl of cheese, like
Sorry?
cabbage rolls, like rice, so it's like a homemade cabbage roll for
Yeah.
breakfast. Like those leftovers are great.
Leftovers are great.
It doesn't matter if it's for breakfast or not,
Yeah.
as long as they eat.
Exactly, as long as they eat. So this is the 21st chromosome. So I'm going to get into the science aspect of this now. And I went over this with my husband, and he was not like, this is too much. So please tell me if it's too much. And I have no idea what the time is either.
Not much time.
Oh,
We can go over the last session of the day, so
Okay.
we go over if people are comfortable, they can wait.
okay. Is that all right? Because there's quite a bit on this section.
Well, I was gonna thank you.
I have to go. Thank you so much.
Do you want to thank me now, Nick, or you want to stick
Well,
around?
I can thank you now. If you don't mind. All right.
Oh, no.
Well, thank you. Your presentation really well. So, as well to say thank you for your hard work and commitment to the city SS, and also on the behalf of VADA and of course the Epidemic Committee, I want to present to you a present.
Oh, geez. Oh, you gotta walk it. I'll walk it there.
So this is a token of our gratitude and say thank you, and I just wanted to say, and you really inspired me. And I did have one question in particular.
Of course, go for it.
That's so
you.
Would you like to stand up for breakfast?
No.
I told you.
Well, thanks anyway. Goodbye, folks. Have a good meeting, and I'm gonna have my muffins.
With your coat, right, Nick?
Yeah.
Nick, maybe can we do like a herbal tea or something for breakfast instead?
No. I eat the healthy. I eat the carbs. I'm a human being.
No, my husband likes Coke too. My husband likes Coke.
See? It's healthy.
I didn't say that.
We'll fight the power.
Okay, so
I got my
this may
breath.
seem a bit overwhelming, but this is the genes that I want to get into. Okay, so the first gene is the APP. Are we familiar with some of the, how many of us have actually looked at some of the genes? Okay, so a quarter of us, some of us. All right. Okay, so I'm going to go into this, and by all means, if I'm going too fast or if I'm going too detailed, just please tell me that's enough. So APP, this is the gene that it codes for the amyloid protein. Amyloid protein is implicated with Alzheimer's. And as we know, with individuals with Down syndrome, there is an increased risk of one, having Alzheimer's, and two, also developing it early. mind you, this also, Alzheimer's is also familial too. So if there is a family history of Alzheimer's, then yes, there is an increased risk of early development and also potential risk of developing Alzheimer's. But if there's no Alzheimer's in the family, then it should not be as huge a concern for the individual with Down syndrome. SOD. So SOD, I'm sure all of us have heard of this. This is a superoxide dismutase. This is actually, for the general population, this is a good gene to have. It keeps us young. It keeps us healthy. People actually take supplements of SOD. But what happens with the individual with SOD, so it's actually an antioxidant. But with the SOD, and I'll get into it a little bit further, is that it creates what we call singlet oxide. And that singlet oxide goes around causing havoc to the cell membranes. So 3 copies, you get a lot of singlet oxide. But there is a way that we could potentially decrease that singlet oxide or quench that singlet oxide. DYRK is associated, is linked with the megakaryocytic leukemia that happens in the younger individuals with Down syndrome. However, as it's also found to be protective for the individuals with Down syndrome. So 3 copies of this gene, when an individual gets older, it actually protects them against solid tumors. So if you take a look at the population, solid tumors with the Down syndrome population tends to be decreased compared to the general population. So it is actually protective. IFNR, this is the receptor for interferon. So interferon is used for treatment of cancer, for autoimmune, and for chronic disease. So this actually, possibly along with the DYRK, can be protective against the solid tumors. So that's also seems like a good thing. COL6A1 is on the 21st chromosome. There's COL6A3. So this makes the collagen. This makes our skin. And this gene is potentially associated with what causes the heart abnormalities, and also associated with the facial differences too with individuals with Down syndrome. So that really, if you want to try to manipulate that gene, it has to be done in utero, right? Which most of us don't have the knowledge that our child will have issues with heart disease. So there's not that much that we can do about that gene. CRYA1 is associated with cataract formation. So this we can do something about, especially since individuals with Down syndrome also have issues with vision. So we can talk about what can we do to deal with this gene. And the other 2 genes I've written down, so but there's not that much information that I've come across, and I ran out of time, and it seems like I'm going to run out of time anyways. So DSCR1 is associated with brain and heart communication, and ETS2 can be associated with a decreased thymus gland and immune issues. So that could be one of the reasons why the kids with Down syndrome have, I personally don't think they have that much of issue. I think it's more the low muscle tone that causes them to have more issues with the immune system. Okay, so the APP. Are we good so far? Mm-hmm. So far good, okay. So the APP gene, this is the gene that codes for the amyloid beta. And that's implicated with Alzheimer's. So the treatment strategies that we want to do is we want to try to decrease inflammation in the body. And we also want to decrease the deposition of the amyloid protein in the brain. Vitamin D is a big one for that. There's actually been, if you take a look, the very last, this one, this reference is the beneficial role of vitamin D in Alzheimer's. So what it's found is that vitamin D within the study decreases the amyloid deposition in the brain. And as we all know, living up here in Canada, we don't get enough vitamin D, right? We know that study?
Yeah.
Okay, the breast health, the breast cancer, the prostate cancer study. So especially with our kids, we want to make sure that they do have vitamin D. Especially in the winter month, definitely in the winter month, but it may be something that you want to have them on a daily basis. So this is something, it'll be a daily thing. It'll help also, vitamin D will also help with growth too. Like Jay, even though Jay's parents are both vertically challenged, Jay is on the normal growth chart. And he's actually following the same growth chart as his brother is. So we're pretty pleased with that. Yeah.
Vitamin D, can it be mixed in with the cod liver oil, like they're combined?
Yeah. Actually, cod liver oil typically does have vitamin D in it.
Is it true that mushrooms are good for vitamin D?
I haven't heard that.
I read it on a package and I was really surprised.
Okay. As far as I know, vitamin D is animal sourced.
Yeah, that's what I thought.
Yeah.
But
It may not be the absorbable form of vitamin D.
ah.
There isn't one, some vegetarian sources of vitamin D come from lanolin, which is, from sheep, but from the fur of the sheep. So when they're cut down, when they're sheared, you can actually get the D from there. That's the only vegetarian source that I know of vitamin D, of the active form of vitamin D.
That's a lot of EPA.
That's a lot of EPA. Well, I'm talking about Alzheimer's though.
Oh, okay.
Okay, I'm not talking about the little kids. I'm talking about Alzheimer's here. And that's actually not that much.
You're talking as once you have it? Or
Once you have it, or if you have that family history,
Okay.
then you want to deal with it. Yep.
For vitamin D, what's the regular blood test you have to ask for?
Your MD will not do, it depends on your MD. It's not OHIP covered. What was it?
No, I was just saying that.
Yeah, you can test for vitamin D.
And I think it's either $25 or $50, I think, for
Yeah, yeah, and you can certainly test for it. But there are, like, I haven't jumped on the wagon to test my clients for vitamin D. I usually do a trial and error. So especially if there's mood issues, I'll ask them to take some vitamin D, especially if it's like that seasonal affective disorder. So the February blahs. If I know that someone's going to end up with February blah, then I'll start them in October, November with just 1,000 IUs of vitamin D and see if that prevents that February down blah. And usually that's, for my clients, that's typically enough. Okay, so omega-3, melatonin also. So melatonin, there's another study with melatonin and its association with Alzheimer's. So melatonin dosage, and then we're talking the older population here, right? So melatonin can be dosed anywhere from 1 to 20 milligrams. That will be in capsule in supplement form. 20 milligrams is typically what we tend to do in cancer treatment, though. So that's not Alzheimer's. Yep.
So could you comment then on what your thoughts are on starting children with this type of supplementation?
I would do D.
Rather than waiting until there's an issue?
I would do the D with kids, and I would do the omega-3 with EPA and DHA. I don't feel comfortable doing melatonin, and I don't even do, if I have somebody coming in, for instance, general population problems with sleep, a lot of I teach at the Naturopathic College. So some of my students want to jump on the bandwagon and say, I want to prescribe melatonin. My preference is let's try some herbs, let's try some lifestyle counseling, see if that'll change up, change their sleeping pattern before I'd go to melatonin. I would rather not work with hormones unless I desperately, I've exhausted everything else. So I wouldn't do it in kids. Okay.
Melatonin is a hormone?
Melatonin is a hormone. It's a sleep happy hormone. All right, so this is the SOD. Okay, I don't have my pointer. So we've got SOD, so we have oxygen, electron, goes to a hyperactive oxygen species, singlet superoxide dismutase comes in, and it causes hydrogen peroxide. This hydrogen peroxide in the normal population goes through the glutathione pathway, and it gets changed into 2 molecules of water. If this pathway is not working very well, which tends to happen with individuals with Down syndrome, what will happen is hydrogen peroxide goes into hydroxy. Because there's a negative charge on that, it will go, it's like a singlet oxygen, and it will go and cause problems with fat. So all of your cell membranes, it'll start attacking the cell membranes. Good news is that this pathway can't be stopped. If we do vitamin E you can get from nut oils. So any kind of nuts will have vitamin E in it, and then NAC also. NAC will come from any sulfur-containing food will have NAC in it, and it's not. So supplementing with those two nutrients can decrease the lipid peroxidation. But what we want to really do is increase this pathway. Yep.
So in Down syndrome, it goes to the right?
No, it goes through both, but because we have that extra copy, the rate limiting is the glutathione pathway. Because we're not having sufficient amount of glutathione because this comes in excess, right? So what happens is normally this pathway happens, but if you have too much of this, then it's going to go this way and it'll go this way. So other pathways have to take over to compensate for this, which is the rate limiting.
So lipid peroxidation?
Yep.
You're saying that attacks fat cells?
Lipid is fat. So peroxidation means adding oxygen to fat, which because we've got that extra the electron. What it does, it will stop. It'll change up the communication within the cell.
Just that cell?
Just that extra electron will change up the communication. It's like, it's kind of like a little mosquito. It kind of goes from fat cell to fat cell, and it disrupts the communication, and it also can disrupt the actual cell membrane itself if there's too much of those things around.
Is that any reason that a Down syndrome person would gain weight?
It could be because the cells aren't communicating well enough. So whatever hormone is, like for instance, if insulin's coming in, it's not going to be able to attach properly to the cell for sugar to get into the cell or sugar to come out of the cell. Because the cell communication is disrupted, it could be, but I think the weight gain is most likely due to most likely due to the thyroid issues.
So every DS person has this?
We all have this. This happens in all of us. But with Down syndrome, there's too much of this. So what we need to do is we need to shuffle everything as much as we can here and also prevent this from happening.
And what's the N-acetylcysteine? You said more NAC?
NAC, that's just an amino acid. It's an amino acid that's manufactured in the body, but it's also an amino acid that you get from sulfur-containing foods. So smelly foods, the broccoli, the eggs, that kind of stuff. Okay. There is also the iron. So I have a bit of a presence on the internet with Down syndrome, and I have people who are opponents of mine, and they don't agree with me saying that we should have some iron we should be giving iron to our kids. We should be giving iron-rich foods to our kids, but I think if they're not getting an adequate diet, there should be some iron supplementation. And the reason why I say that is because with kids, especially when they're growing, they need to have energy. And the way they have energy is through red blood cells. If they are anemic, they're not going to have energy. They're not going to be able to focus. They're not going to be able to concentrate. They will not grow. I have this one little kid that came in, and he wasn't eating anything. He had no appetite. And I said, I thought he was anemic. And I said, I asked Mom to go and get the blood work done, get a CBC done. And sure enough, he was anemic. And as soon as we started getting him to eat, supplemented him with some iron, his appetite went up, his weight went up, and he was so much more active. So I think there's a time when we shouldn't be giving iron to individuals with Down syndrome, but I don't think we should stop them from having iron in the very beginning of their life when they have that growth. I think iron is important. So you might read people saying the iron's bad, but I think it's important. In amounts, in small amounts, it is important. Okay, so superoxide, this is basically what I just said. So the redox imbalance, what it happens in the mitochondria, which is the energy factory in the body. And I've got, okay, so things to quench the hydrogen peroxide. Glutathione. Glutathione is a essential amino acid. It's not something that we manufacture in the blood, in our body. Actually, sorry, it's a non-essential amino acid. We do manufacture it in the body, but the individual with Down syndrome does not have adequate amount of it. Supplementing with glutathione is very expensive. Is more expensive. So supplementing with glutathione may not be the right thing to do because it doesn't get absorbed very well. There are precursors though. So precursors to glutathione is NAC. Precursors to glutathione is also methionine. You also need B6. So these amino acids and also vitamins are quite important to manufacture glutathione in the body. But you also, the methyl donors, you also need to regenerate. So if you go back, see, glutathione gets converted whenever this gets broken down, so it gets changed to GSSG. This pathway goes back, and this pathway goes back by the methyl donors, the methylcobalamin, the methyl tetrahydrofolate, and also the methionine. So those substances, those factors are very important to change over. So you can either, the methyl B12, that would be in a supplement form. And methyl tetrahydrofolate, that is the active form of folic acid. So I would not give a kid with Down syndrome just plain folic acid. I would want to give them the methyl tetrahydrofolate. You get folic acid in its active component from your leafy green vegetables. So if you don't want to supplement, lots of green leafy vegetables. And methionine is your smelly foods. So Brussels sprouts, cabbage, broccoli, eggs. TMG, I think you guys, you've heard about TMG, trimethylglycine? Okay, trimethylglycine is also really amazing factor. It is associated with increasing, it is a methyl donor, but it's also associated with increasing speech, specifically in the individual with Down syndrome. So supplementing with TMG, and it does come in powder form, does help, and I've seen this, does help with speech, especially in the beginning. Trimethylglycine.
What about if they're older?
I think it would still help. I think it'll still help, but if they're older, then you want to also do the omega-3s too.
Sorry, so where do you get TMG from?
TMG you can get online. There's a company called, it's not Kirkland, it might be Kirkman, because Kirkland is Costco. There's a company there's a lab in the States, they do TMG, and I think they do TMG with methyl B12. It comes in a powder form. Okay, DKDYRK. Are we good with SOD? Are we still with me?
A little bit lost.
You're lost a little bit. Is anybody else lost? Okay, sorry. Okay, where can I go back? Nowhere. Nowhere? Okay, I can, do you guys want me to continue because it is really technical? Or would you rather stop here and go questions? Questions? Okay.
I just wanted to ask, you are saying here supplementation to minimize the effects of SOD1.
Yeah.
I've been giving my daughter MSB. How does that compare to the supplementation you're talking about?
And
Are you familiar
MSB
with
is,
that
yeah,
from-
yeah. MSB is a multivitamin,
Yeah.
right? I don't think they have TMJ in it.
I know, and you just, that's what.
Yeah, I don't even think they have the methyl tetrahydrofolate in it. And they might have the methionine in it.
It's been a long time since I looked at the list of ingredients.
Yeah, and I don't think they have the methyl B12 in it. So those ones you want to make sure. There are quite a few different formulations out there, and what you want to do. Like I actually, when was it? When Jay was, because when Jay was born, or when we found out about Jay, we ended up. That's when I started. So at 5 months, when I found out that he was wrong, I started doing research into, okay, what can I do for my kid? And I used to teach nutrition at the Naturopathic College. And then after he came, my lifestyle changed. While I was teaching, I also started doing nutrition. I had some colleagues that also helped me out too. And this is some of the stuff that I found. So I was starting to supplement when I was still pregnant with him. And the pretty neat thing was when he was born, the neonatologist on call actually questioned the DS diagnosis, because he looked like a normal kid. He acted like a normal kid. Of course, he had DS, but because we did amnio and we knew that he had DS. But it was pretty neat to see that. And then while I was breastfeeding him, I did a whole bunch of different supplementation, again, myself, and then that would pass through the breast milk to him. Once he started eating solids, then about a year old, I started giving him like a lot of B complex, and like our kitchen was a pharmacy because there were all these different kinds of supplements. And then I thought there's got to be something better, because I was spending so much time like putting everything together for him and forcing him to take everything. And I looked at all of the other things out there, and I felt it wasn't giving me the right therapeutic amount of what I wanted. And then I designed my own, and it was mainly for him. And that's kind of where I have all this feedback from other people about the iron and all of that. So MSB, just make sure it's got the methyl tetrahydrofolate. I don't know if it has the TMG either. Okay? Yeah. Any other questions?
Do you know anything about stem cell research for Down syndrome yet?
I don't know anything about that. Does anybody know about stem cell research with DS? No. Sorry. Yeah.
Given how complicated this is, are there any other naturopaths who specialize in Down syndrome?
There are a couple in the States. There's one other woman who has a kid with Down syndrome. And then there's another woman who does work with kids with Down syndrome. I do have, in Alberta, I have one of my students who does work with individuals with Down syndrome. So if you're from there, I can give you his name. There aren't, because it's such a small population, right? So there aren't too many NDs out there. I think in Ontario, I'm the one who's got the passion. Not that I'm saying come see me, but I'm the one who's passionate about this. Because I live it.
Right. Yeah. Do you consult with others?
I would, yeah. Yeah, if they could give me a call, definitely. Yep.
I'm just wondering how, if wanting to look further into this, how do you pick a good MD? I have no idea. Like, I wouldn't even know where to start besides the elevated.
Usually it's by referral. Okay. So do you know anybody that's seeing an ND?
No, I don't.
Okay.
I'm from a small place, so there's probably...
If you want...
I'm in Fredericton, New Brunswick.
Sorry?
Fredericton, New Brunswick.
Okay.
So there's not a lot of people to choose from.
If you want, check around who is there,
Yeah.
okay? And then if you want to send me some names. Because I've been teaching there for, I think, about 13, 14 years now. So I can give you some feedback. How's that?
That'd be great.
Okay. Right. Any other questions? Yep.
Someone who says they're a naturopath doctor versus a homeopathic doctor, are there vast differences?
Oh, huge differences. As a naturopathic doctor, we have training in nutrition. Homeopathic doctors do not have, they may have very little training in nutrition. The curriculum is very different. Naturopathic medicine, our curriculum is 4 years, whereas the homeopathic school is 2 years, and it may even be part-time 2 years. We work with botanical herbal medicine, counseling. They don't do any of that. They will be regulated. We are regulated. I don't think your insurance plan will cover homeopathic doctors, but if you have extended health benefits, it'll cover naturopathic doctors. Questions?
Yeah. My brother has kind of borderline high TSH levels, and so just because of, I guess, personal choices, we'd rather not put him on like a prescription thyroid medication.
Okay.
Do you find that natural thyroid supplements are successful for people with Down syndrome?
You know what? In the adult population, I don't know.
Okay.
I haven't
You don't
looked.
prescribe it?
No.
Okay.
In the general population, though, I think we can use natural products to work with people with high TSH.
Okay.
I don't see how that would be any different, though.
Yeah.
Yeah. Any other questions? Yep.
In your pamphlet, you talked about the New Downs supplement that you developed.
Yep,
Did you talk about that earlier?
I did not talk about it because I didn't want it to be about New Downs. I wanted this to be more about naturopathic medicine. So,
Do you mind?
So this is like a nutritional supplement?
It's a nutritional supplement.
Or does it address the changes as a result of the...
It does, in terms of the New Downs, I have the methyl B12 is in there, the methyl tetrahydrate folate is in it, the methionine, all of the nutrients that I'm talking about are in pretty good dosage for individuals with Down syndrome.
Would it replace a nutritional supplement?
Yes.
Or would it be on top of,
No.
like you just give them?
No, it is a separate vitamin, mineral, and amino acid. The only thing it doesn't have is the omega-3 because it's in a powder form, and if you throw in omega-3 into that, it stinks. So we've just kept the omega-3 in a liquid form, and then the New Downs.
Because it occurs to me, all this is very complex, you know.
It is.
And so what we need is someone like you to be figuring out the consequences of the 21st gene and how best we can, you know, suppress pathways, maximize pathways, compensate, etc., and package it all into something for us,
yeah.
you know?
That's what
rather than going individually for different things.
Yeah, and that's what I was doing with Jay in the very beginning, right? I had about 5 or 6 different products that I was using with him, and it just seemed really difficult.
I mean, when Joe was born, we weren't even that big dudes, I don't think. Like, it's amazing what has happened in the last 20 years.
I worked on the
What
gene.
is possible, really, yeah.
Yeah, just for 1 year.
Yeah, I just have a comment. I had my son, he's 9 years old, I had him on the MSB formula for probably a year, and then I stopped him. And what I noticed is, during the time that he was on it, his concentration seemed to have improved, and it's only anecdotal. And, you know, I decided to take him off, but you hear all the other information that says, you know, you shouldn't be putting your child on, you know, like the American Down Syndrome Association recommends, you know, doesn't recommend vitamin therapy, all this other stuff.
I completely disagree with
Well,
that.
and you know what, and it's interesting, because when I took him off of it, and now I get comments back, you know, we gotta work on his focus and concentration and all that other stuff, so, anyway, that's just a comment that.
Yeah, well, you've got that extra chromosome, right? Like with the SOD, we just talked about the SOD, but you've got to do something to decrease the hydrogen peroxide molecules being produced, right? You have to decrease, not the hydrogen peroxide, the hydroxy molecule from being produced. Otherwise, if it's going to happen, it's going to cause havoc. And there's so many other genes out there on the 23rd chromosome. And honestly, we don't even know. Most likely don't even know. We probably know maybe 1/8 of what we could know. There's so much more that we can look at in terms of this.
your focus on nutrition and vitamins and whatnot that you've lived with your own experience, generally, I hope you don't mind me asking, how is your son doing overall?
He's doing well. He's in grade 2. He is like, you know what the best thing for you to do? If you Google my name, or go onto the New Downs website. There's a whole ton of videos that I have there, and it's Jay through various stages of development. He just did he's in musical theater and he loves it, which I haven't posted this yet. It's my tech daughter has to do this, so we have to post it, but he was fabulous. He was just, we were expecting nothing, but at the end of the whole thing, I was in tears. I thought it was just so incredible. So, you know, he does musical theater. He's testing for his yellow belt in Taekwondo. He's integrated, and his yellow belt is with his peers at school. He's got lots of friends. He has 3 girlfriends. He can't pick between the 3 of them. He's doing fabulous. Any other questions? Okay, I hope I haven't overwhelmed you guys here. Are you copying?
Because I don't see that note, a lot of note on the TMJ.
Oh, is it cut off?
Go ahead, go ahead.
Yes, I see.